Welcome everyone to this Ask Dr. Kristina talk. Today we're going to be talking about something that's really important to me, um, and it's actually very personal to me because how I became a functional medicine practitioner, and it's all about the thyroid and the thyroid reset, and like why, even though people tell you your labs are normal and everyone tells you there's nothing wrong, that there is something wrong and you need to go deeper. Um, and we've had many patients over the many years I've been doing functional medicine come to us with thyroid issues with different symptoms. So, today I want to ask you, do you wake up tired no matter how much you sleep? Do you forget little things, like forget mid-sentence, think that maybe you're suffering from early mild cognitive impairment? It may be, but it may not be. Do you feel cold when everyone else is fine all the time? Have you been struggling with constipation and thinning hair and low mood no matter what you do? Do you just feel like you're not yourself anymore? And these symptoms can all be connected. And what if I was to tell you that they're all connected to the thyroid and you've been missing something? And today we're going to kind of elucidate some things for you. So that's me. I was a mom of three small kids. I had a baby, a 2-year-old, and a 4-year-old. I kept going back to my doctor and saying, "Hey, I don't feel right. I was really tired. I'm a very energetic person." For those of you who know me and have worked with me, um, I've got lots of energy all the time. And after my third baby, a year after, I really was extremely tired, couldn't think straight, and I, went back for lab testing and went to my doctor. Uh, and they were like, your labs look great. My labs look great. Nothing looked, they're like, you're a new mom. That's normal. I was eating pretty well, but not as well. When I went a little deeper and found functional medicine and started looking at, whole panels of blood, proper functional ranges, looked at like my diet and lifestyle, and food and things that I thought I was being healthy that weren't healthy for me at that moment. And I realized that I had an autoimmune thyroid condition, which was triggered by my third pregnancy. When I was able to look down deep into what was triggering that autoimmunity, my thyroid symptoms that no one could tell me, I had anything wrong with me. When I was able to get that under control, I started to feel more energy. My hair came back. I wasn't tired and cold all the time. And so I decided to also get training in functional medicine to find out why people are having symptoms and not just what to treat. And that's, why I'm so passionate about thyroid health, because it's really what brought me to functional medicine. I actually had an H. pylori infection after my third baby that triggered my autoimmunity. It's one of the biggest triggers of autoimmune thyroiditis called Hashimoto's thyroiditis. And I had no symptoms. I had no reflux. I had no GERD. I had no heartburn. I didn't have burping from low stomach acid, but I had all these things going on inside me. And because I didn't have any outward symptoms outside of being tired and kind of bloated and a little constipated and a little forgetful, and people telling me, "Hey, you're just a new parent or you're getting older," I really was at a dead end until I found functional medicine. So this work is very personal for me. It's really why I came to functional medicine, and I hope that this webinar gives you some clues as to, what might be going on inside of you and what steps you can take to start really healing yourself and feeling good. And I hope you feel heard, because I know I didn't, and I know that's one of the things that I really want you to understand, that any symptoms you're having are from something. And just because a doctor says everything looks good, it might be in your head, it doesn't mean it's the case. It means he's exhausted or she's exhausted the tools that they have in order to screen you for something else. And you have to keep looking, because I kept looking and I found it. And now it's my whole life is functional medicine. So I've been a practicing chiropractor for over 26 years. I got certified in functional medicine about a decade ago. My practice is always filtered around kids and moms and the community. I love training. So I've done training in gut health and autoimmunity and functional pediatrics because I love children. I was really lucky to get personally trained by the brilliant Dr. Terry Walls, who put her MS that was debilitating for her for 27 years into remission. She teaches all over the world now the diet and lifestyle concepts of functional medicine and root cause analysis to put people's autoimmune conditions in remission and their MS. And I've been trained in cognitive decline by the equally brilliant Dr. Dale Bredesen, who was able to put hundreds of patients who were diagnosed with Alzheimer's into remission, and even some get their cognition back. So this is a lifestyle for me, seeing that food and lifestyle protocols that we use in functional medicine, that are actually quite simple and easy for the average person to do who's suffering, and seeing the radical results and changes that would happen in short periods of time. I'm excited about sharing this information with you. It really you created an explosion of results for my patients and even my family. So that's me. And let me tell you that your symptoms are not random. The fatigue and brain fog, the constipation and bloating, the anxiety and depression that comes. No matter what you have exercise, you still feel it. The weight struggles, no matter how well you're eating, no matter which diet, keto, paleo, HIIT training, no matter what you're doing, the weight struggles. The hair loss and dry skin. The countless practitioners you've gone to that have not done root cause testing, that have looked at your basic labs and said, well, then that's not a problem here. You might just be losing hair. The cold intolerance and mood changes, all of these symptoms are not random, and they can all be traced back to the thyroid. Thyroid disease is so common. Even back in chiropractic college almost 30 years ago, when I was in school, we did a lot of practice and a lot of education in our functional diagnostics training on thyroid and adrenal conditions because they are so prevalent. 1 in 10 Canadians are affected with some sort of thyroid disease: hyperthyroidism, hypothyroidism. Hyper is a fast working thyroid, and hypo is a slow moving thyroid. 50% are undiagnosed. So 50% are just like you who have symptoms, and their labs may look really normal. And women are 5 to 8 times more likely to have thyroid issues compared to men. So, that is a huge thing. The thing that I'm noticing the most, that's the most alarming, is that autoimmune thyroid conditions are on the rise year over year. And most people don't know they have it because they're not being tested for it. And what I've seen even more, that's even more concerning for me, is that I want to get the message out to, is that I'm seeing young girls, young teenagers, 13, 14, 15-year olds, that when they get checked properly, that they are also suffering from autoimmune thyroiditis. And it's a really early stage in your development that you really need your thyroid working well, and you need your immune system to not be overreacting to whatever's going inside. So it is really an alarming rate, our thyroid issues that we're seeing. I think it's the number one prescribed medication in Canada is thyroid medication because it's so prevalent. But just because it's common and it's prevalent doesn't mean it's normal. And sometimes if your thyroid numbers on your lab work look normal, as mine looked very, very normal, we're in the perfect ranges, you will be told there's nothing wrong. And when I actually delved deeper and looked at my thyroid hormones, my active hormone, and if there was any autoimmune antibodies to my thyroid and found that they were there, it explained all of it for me. So let's talk about what your thyroid actually does. So your thyroid is like your body's thermostat. When it's off, like everything is off. When it's on, it's great. When it's on, your metabolism is good, you feel good, your digestion works well, your hormones are good, you have good body temperature regulation. But when it's off, your metabolism is slow and you can't seem to lose weight no matter what you do. Your your serotonin, for focus and motivation, and your way your brain functions is also affected by your thyroid. And when it's not working well, either it's working too fast and you feel very squirrely, very hyper, like you can't focus, and your heart rate is high, or it's working slow, hypothyroid, which is more the cases we see than the hyper. Or we have a fluctuation between hyper and hypo, which is the autoimmune presentation, Hashimoto's thyroiditis. It can affect all these things. It drives gut motility. So the way that the food moves down the intestines is driven by thyroid function as well. And it coordinates with estrogen and cortisol and insulin, which are our sex hormones, our stress hormone, and the way we process and signal, breaking down sugar. So the thyroid really has, this incredible span of things that it affects in your body, and one thing affects the other. And so it's really important to look at all of the different kinds of symptoms to figure out if you actually have a thyroid issue, or if you're just tired, or you're not eating the right diet, because when your thyroid slows down, everything slows down. Your energy drops. You're tired. You're more tired than you're used to being. You become constipated and bloated. It's very, very common to suffer from chronic, slower bowels, slower motility when you have a slow thyroid, hypothyroid, even if your numbers look good. You get forgetful, you get brain fog, and a lot of people get anxiety. It's really, really common. and they're diagnosed with an anxiety disorder, but no one checks their thyroid. I find in children, they become anxious and like inattentive, unable to think straight. And so in children and teenagers who have thyroid issues, especially slow thyroids, they're typically not tested. But what we normally see is that they're diagnosed with ADHD, and it's not the right diagnosis. The diagnosis should be fixing the thyroid, the way the thyroid functions. The ADHD, the inability to focus, the hyperactivity, that all comes from the root cause of that is the thyroid dysfunction. And it can be healed when you heal the thyroid dysfunction. Your metabolism will stall and you have mood shifts. So you become depressed, irritable. So again, some atypical depression that doesn't respond to medication is sometimes missed thyroid dysfunction. Traditional testing looks at a very narrow set of markers. It's actually extremely outdated. They'll check your TSH, your thyroid stimulating hormone, and they'll check the T4. And if those two numbers are good, they'll say everything looks good. And it's exactly what happened to me. My numbers were perfect, right in the middle of the range. So even if you took a functional range, which is smaller at the top and bottom end, mine looked perfect. Everything looked normal, but I didn't feel good. And I had slower digestion. I was cold. I was tired. That was the biggest thing. I have a lot of energy. Um, Functional medicine really asks different questions. And here are all the different kinds of things that we look at. We look at TSH, thyroid stimulating hormone. Is the brain telling the body that it needs thyroid hormone? Free T3, is the hormone being produced? Are we stimulating the body to produce more free T3? Are we looking at free T3? Sorry, that was free T4. When we look at T3, it's the active form. Is T4 converting to the active form of T3? That requires cofactors, minerals, and vitamins. Are we looking at reverse T3? Is our hormone being uh, shunted in the reverse T3? And that usually means the body's blocking conversion from T4 to T3. And that's usually due to some inflammatory process going on in the body, sometimes driven by gut dysbiosis and stealth infections that we haven't looked at. Do you have antibodies? So there are antibodies that you can look for that are specific to the thyroid. And this is the piece that never gets checked. And I think it's because a traditional, conventional approach to slow thyroid is that you give it Synthroid. You'll give the patient Synthroid. But if your body is responding to your thyroid like it sees it as a dangerous stranger, it is attacking the thyroid, not for no reason. There's always a reason. We have some H. pylori that's creating a different look in your thyroid, and your body's attacking what looks different, so it doesn't look like thyroid cells. Different foods, antigens, proteins can look like thyroid, and when you're reacting to certain food proteins that are molecularly and chemically similar to your thyroid cells, the body will mistake that. So we have to look at the antibodies as well. Is the immune system attacking our thyroid? Because if our immune system is attacking our thyroid and all we do is give ourselves, the thyroid hormone so that we feel better, which is great, our symptoms are gone, our body continues to attack that thyroid. And then we have an increased need year over year to up that medication. And we're not really looking at the root cause. And you still end up feeling really poorly. You have to look at nutrients, gut, and inflammation and what's driving all of these issues. Sometimes you're making the thyroid hormone, your brain is signaling your thyroid to produce that thyroid stimulating hormone, but then stress comes and blocks the conversion of the inactive form T4 to the active form T3, which is what we can use. So sometimes it's stress blocking it. Sometimes it's inflammation and it goes to reverse T3 like we talked to. Nutrients, there are certain nutrients that are really important for thyroid function, for conversion of T4 to T3, for TSH to be working, for adrenal glands to be working. Sometimes if you have stealth gut infections or heavy metal toxicity, that'll also disrupt the conversion and disrupt the pathway to making that active thyroid hormone. So all of these things are important. So even if your labs look normal, your TSH and your T4 are normal, if you're not converting your T4 to T3, your cells are starving for that thyroid hormone. And these are all the multiple things that could be just, you know, some of the causes that can be causing that block in conversion. Hashimoto's thyroiditis is when the immune system is attacking the thyroid, causing the thyroid to work less well. So causing a hypothyroid, which is that constipation and slow thinking. Now, Hashimoto's is interesting because it can fluctuate between like a fast moving thyroid and a slow working thyroid, but it's an autoimmune condition, which means it needs to be treated in the same way. And up to 90% of hypothyroid cases, slow thyroid cases, involve some form of autoimmunity. And if we're treating only the thyroid with the thyroid hormone, we're really missing the thing that's driving the symptoms. We're really missing the root cause. And there could be multiple root causes as to why, your body has now been triggered with an autoimmune response to your thyroid. Pregnancy, like I said, can be the major trigger. It's one of the number one triggers of Hashimoto's thyroiditis. This was my trigger for my third pregnancy. The massive shifts in hormonal stress on the thyroid system, even the stress of, pre and postpartum. The immune system changes after pregnancy, and that can activate autoimmunity. You can become nutrient depleted. Some women can't eat well when they're pregnant. They don't feel well. Iodine, selenium, and iron are really, really common. And postpartum, it's even more common to be nutrient deficient. You lose a lot of blood. The baby is, if you're nursing, you're giving a lot of nutrients out. And it's almost always missed because the way you feel postpartum, tired, your hair's falling out, is chalked up to it's just your hormones postpartum. You're going to be okay, which is actually what I did to myself because I thought, okay, I just feel like that because I have three small children. So I missed it as well. And the gut matters so much more than you think. 70% of the immune system, some references say 80%, so up to 80% of the immune system is found in the gut. And gut inflammation can trigger this autoimmune process. And the T4 to T3 conversion is supported by the gut lining. So we have this gut thyroid connection. And because of this gut thyroid connection, we have to look at the gut and see what's going on there. A leaky gut is also one of the three things that you need to trigger and activate autoimmunity. You need to have a genetic predisposition to autoimmunity. Maybe someone in your family's had an autoimmune disease. You need to have some sort of trigger. It could be an infection, it could be stress, and you have to have leaky gut. So the gut is really, really important when you're looking at someone that may have autoimmunity. Okay. So the number one thing that I see changes symptoms for patients with thyroid issues, especially thyroid autoimmunity, is gluten. Gluten or gliadin, the protein found in wheat, found in pastas, found in flours, found in baked goods, can can turn on a process called molecular mimicry. And basically, molecular mimicry is when the protein of that food, the gluten protein, it structurally, like chemically resembles the thyroid tissue, and the immune system is already revved up to the gluten. And then it kind of is overreacting. That's what immune system that has having an autoimmune response is doing. It's overreacting. So anything that it sees that looks like the thing it's that's a dangerous stranger, it will attack. And since 50% of that protein structure in gluten or gliadin resembles thyroid tissue, it automatically attacks that. And I will tell you, my patients who just remove gluten, here's like easy low-hanging fruit. If you think you have this going on, if you think you have thyroiditis, if you think you have any autoimmunity, and you haven't removed gluten, try it for 4 weeks, 100%. I know that seems impossible. The first week is the hardest, but 80% of people's symptoms go away and go into remission when they remove gluten. 80%. It's a really easy thing to do. The immune system can confuse the two things, like I said, and attack the thyroid cells instead of, attacking the gluten, which it sees as an inflammatory, dangerous stranger. Every time you re-expose yourself to this gluten, if your body is having this kind of reaction, can re-trigger the immune system attack on the thyroid. And so the thyroid slowly gets destroyed. And if we just give the patient thyroid hormone, we are not stopping the attack. And what people don't know is that once you've had one autoimmune condition, your chances of having more increase. And I'm not sure if that's because your body's already primed or if it's because you haven't gotten to the root cause of the reason your immune system is overreacting. But it's not really overreacting, it's reacting to something that you don't know. It's giving you a message telling you that it's really upset and it feels like it's being attacked. And it's just our job as integrative practitioners to really look at what are the things that are putting the body out of balance. Why is it out of balance? So here are the nutrients that your thyroid actually needs to function. So for TSH to form T4, for T4, the inactive hormone, to be converted to T3, you need selenium, you need zinc, you need iron. So those of you who struggle with low iron, as I do, And low iron for no reason. Even if you eat plenty of iron-rich food, I eat a lot of red meat, still have low iron. It's a acid issue in my family, but that's another story. But if you have low iron, can also create a slow functioning thyroid. So iron is really important. I like iron from food. Um, if you don't like a lot of red meat, I really highly suggest beef liver pills from grass-fed cows. It is the quickest and easiest way not to overdo iron and have your body get the nutrients it needs. Vitamin D also regulates immune system function and immune system response. Omega 3s found in fatty fish and chia and some nuts can also reduce inflammation, which helps your thyroid function, and protein. Protein provides essential amino acids that we need for hormone synthesis so that we have enough of this thyroid stimulating hormone, this TSH. And these are all things you can get from your diet. I really encourage people to try and get as much as they can from whole food. We do use a lot of supplements when people are healing, but the long-term strategy has to be diet and lifestyle. You can't out supplement a bad diet. It's just not possible. Food first. So here are my top foods that if you have thyroid dysfunction, but you haven't been able to, maybe you're not on medication, you don't want to be on medication, maybe you haven't been able to get on top of it, your thyroid medication is not working well, or you haven't been diagnosed, but you have a suspicion. Adding these foods can only help. Brazil nuts is one of the richest sources of selenium, 1 to 2 per day, 1 to 2 per day. Keep them in a fridge so they're fresh. Eat 1 to 2 per day, maybe three. You can eat them just whole. You can throw them in salads. Pumpkin seeds are full of zinc and they're anti-inflammatory. So is meat, full of zinc. Oysters, wild fish has zinc, omega-3 as an iodine. For young kids, I always suggest seaweed snacks that are organic, done with avocado oil, because the seaweed itself has a lot of iodine, and I like to get iodine through food. You can also put seaweed into soups and stews that you make just to get some iodine out of them. Green leafy veggies are like a mainstay. If you don't eat them, start learning to like them. Blend them in your smoothies, put them in your soups, cook them if they're bitter, put a little bit of citrus on them. For patients who, find like for people who find bitter leafy greens, which are so good for digestion and have lots of nutrients in them, find them too bitter, squeezing some lemon or some orange on them really takes some of the bitterness away. That was a trick that Dr. Terry Walls taught me. And just whole, unprocessed foods will decrease the inflammatory load in your body, allowing your body to function better, allowing it to heal. Like I said, you cannot out supplement a poor foundation, poor sleep, poor diet, too much stress. Um, you need to learn how to balance all those things. And some weeks are different than others. So some weeks your food is not balanced, but you're going to bed early just because you've increased the inflammation. Some weeks you have to be up later. Um, so you go for nice long walks, and you make sure your food is on par and you don't eat too much processed food, not too much sugar, because it's stressing your immune system. Life is kind of an up and down roller coaster, and just knowing that your basic foundations of sleep, diet, movement, stress, resilience, when you have those in place, your body can heal. So when we're looking at the root causes of thyroid conditions, especially autoimmune thyroid conditions, but even just thyroid conditions that aren't explained, we always look at the chronic stress and the HPA axis dysregulation. That's your stress hormones. We always look at the gut. We would do stool testing and make sure there isn't a gut infection. And it's very common for Hashimoto's thyroiditis to be triggered by, pathogens like H. pylori, or streptococcus, or parasites like blastocystis hominis. Very, very common. And when you get rid of those, which is what I did, I had a silent H. pylori infection that was really affecting my body, and I just didn't know. And when I was able to get over it, and I used herbal antimicrobials, it was very successful. And I took gluten out of my diet, and I did all the things I'm telling you to do. And I had really high thyroid autoimmune numbers. I haven't had thyroid autoimmune numbers in almost 8 years. I've put it in remission. I have gone back to eating a little bit of stuff once in a blue moon that's not super anti-inflammatory, but my general base is always making sure my gut function is good, making sure my stress is managed. Looking at nutrient deficiencies and blood sugar balance. This is a big one for autoimmune disease and thyroid. It's very stressful if you go long periods of time and your blood sugar drops. It's very stressful on the hormonal system in the body and your adrenal gland, which controls how your thyroid gland works. So looking at nutrient deficiencies, and we look at blood sugar balance. How are you eating? What are your meals like? How often are you eating? What are you pairing in your meals? We will look sometimes at environmental toxins and heavy metals that are maybe, you haven't thought about. It's really important because they can also drive thyroid problems, hidden infections and inflammations, and sleep disruption and circadian rhythm disruption. And usually it's a combination of things that we find when we dig deep with people. Um, and we slowly fix them one by one. And the body slowly starts to heal because it wants to heal and it has the capacity to heal. You don't have to feel this way forever, I promise you. Um, a lot of people don't understand that environmental toxins can disrupt thyroid function. So these are things you can look at right now in your home. Plastics, plastic water bottles, terrible for hormones. It can block and mimic your thyroid hormones. So you have more thyroid dysfunction, but they're also estrogenic, so they can cause a lot of problems with your sex hormones. Parabens and fragrances and heavy metals found in beauty and personal care products. My God, I think this is what's driving the teenage girl, autoimmune thyroid epidemic that I'm starting to see in my practice is that they are so much beauty crap that they are wearing. And it's full of toxic, hormone disrupting chemicals. So removing those and replacing them. Environmental Working Group, ewg.org, is where I go to look at and send patients to look at for cleaner beauty care products. Using household chemicals, pesticides and cleaning agents that are full of chemicals, those can also disrupt your thyroid function. Thyroid is uniquely sensitive to environmental toxins, even if you were exposed a decade ago. And food additives like dyes and preservatives and fluoride, heavy fluoride in water can also create issues because those ions can push out iodine, and iodine is what we need for our thyroid to function. So really like a really easy, actionable step for anyone who thinks they have thyroid condition, or you have a thyroid condition, even an autoimmune condition, or just a hyper or hypothyroid. Um, Removing, and lowering your toxic load will make a massive impact on how your body functions. Stress is chemistry. When we are stressed, we produce cortisol, and that suppresses our thyroid. Um, our conversion from T4 to T3 is blocked. Our adrenal glands, which is kind of our master regulator gland that regulates our thyroid, they're always talking to each other. And if we're stressed out, the adrenal glands are revved up, they produce cortisol, and we can't stimulate our thyroid. And that survival mode that some people are living in, excuse me, my eye is itchy, can really block your thyroid while you're just living there. So I often have patients say, well, I can't get rid of my stress. I have a sick parent. I have a kid that's difficult. I have a job I don't like. What can I do? I want to tell you that you can increase your resilience to stress. So, the stresses that you can control, the stress that you put on your body by not sleeping well, the stress that you put on your body by not moving. And I'm not talking about going and running and doing HIIT training. I'm talking about restorative, um, parasympathetic, relaxing, walking, stretching. Those are all things that are going to put your body into a more resilient mode. Eating whole, clean food. If you are eating like shit, you're going to feel like shit. I mean, it's often asked people, so how is your diet? And they're like, oh, it's terrible. I'm like, okay, so you're gonna feel terrible. And if you know stress is one of those factors that really drives inflammation in your body just because of where you're at in your life, you have stressful teenagers, you have a job you don't like, maybe you're not feeling well, and that's very stressful. The low-hanging fruit that you can control is your diet and your lifestyle. Whole, not processed food. Just start there. You don't have to remove anything, just whole, non-processed food. Here are labs that you should be having ordered that maybe your doctor's not ordering. And I'm going to leave this slide up so you can maybe write these notes. Typical thyroid labs are this thyroid stimulating hormone and free T3, sometimes just free T4, sometimes not even free T3. So we want to see free T3. Usually it's TSH, sometimes it's just TSH. So we want to see, is our thyroid hormone like being stimulated? Are we producing T4? Are we converting that T4 to T3? Is there like a step there with nutrients that we don't have? Is the stress shutting it down? Is there inflammation and it's increasing reverse T3? Also something you need to check. And do I have antibodies to my thyroid? Is it an immune system response? Is my body's immune system attacking my thyroid because it thinks it looks like something else that's dangerous to me? And that's what's changing the thyroid function. Because if you remove that attack, if you stop that immune system attack, your thyroid starts to function properly, which is what happened with me. I'm not on thyroid medication. I worked really hard for a couple of years, but I put it into remission and I feel pretty good. So these are the ones that you want to make sure. If you're just getting TSH done and T4 or just T4, it's literally it's not even the bare minimum. So go to your doctor if you feel like you're having these symptoms, write down these things and tell them I really need to check and make sure that it's not. The only response I have seen come back, unfortunately, is that, well, if it's autoimmune, it's a hypothyroid anyways. But if it's autoimmune, there's lots you can do. There's lots of research. I've given you some information here. You can go down the path and see, why is my immune system revved up as well. You can go down that integrative functional medicine path. Because what's happening is your body is sending you a message, and it is repeatedly sending you a message. It's a signal. The symptoms that you're having are messages and signals. It's not just inconvenient and annoying. It is a signal that your body is telling you, I am not okay, and I'm trying to tell you. Fatigue is not laziness. Brain fog is not just getting older or weak. Anxiety is not just stress. And hair loss is not, just a vanity issue. It is a signal from your body that it is not doing well, it is not in balance. And your body needs you to listen. And you need to figure out and unravel what are the things. Because feeling good is just not good enough. I want you to feel great. I want you to feel like, not like, oh, I'm getting older, so I feel bad. That's literally what I hear from 25-year-olds. You need to feel great. And your messages that your body is sending, you need to understand so that you can, you know, take care of yourself and heal yourself. Because imagine that you feel rested enough in the morning to like greet the morning without dragging your feet, or clear enough to like finish your work easily so you're not running behind, so you don't feel more stressed, warm enough to show up with patience and ease and energy. Imagine that you're like present enough and feel good enough that you can be there for your loved ones, because that's really the most important thing. And imagine if you feel motivated enough in the morning to move forward and feel a little lightness and feel hope. And I hope that you are taking some of these points and really, understanding them and thinking there is hope. You don't have to feel this way. You have to keep looking. And I hope that in this webinar, you have been able to realize that actually you don't have to stop. You don't have to feel shitty, even if you're on thyroid medication. You can start today. These things are so easy to do. Eat whole anti-inflammatory food. So what is that, Dr. Kristina? People say, what should I not eat? I want to tell you what to eat. I want you to eat fruits, colorful fruits, green leafy veggies, cruciferous veggies, onions and garlic for detoxifying the environmental toxins that we're all exposed to. I want you to eat eggs and meat and fish, and whole foods like fats, like olives and avocados. All of these things are healthy, and all of these things are anti-inflammatory. I want you to prioritize protein at every meal, because blood sugar dysregulation can also stress the body out. And you may have been fine to like skip meals in the past, but maybe not anymore. Maybe you've come to a place where your body has been stressed out for too long, and you need to make sure that your blood sugar stays stable. So making sure there's a piece of protein at every single meal, that you don't go 4 to 5 hours without eating something. Remove gluten and processed food, those packaged things. Just don't have them. I don't mean a package of washed salad. That's a good choice. Gluten can be super inflammatory. And if you really can look at these symptoms and say, that really sounds like me, you've got nothing to lose but feeling better. And in all the possibilities of what can make you feel better, if removing gluten for 3 or 4 weeks can make you feel better, you owe it to yourself to try it. It is the easiest thing to do, even if you think it's hard, because you can eat everything else. Protect your sleep. You cannot heal if you don't sleep 7 to 9 hours. Some people need 10 hours, especially when they have a stressful day. So make sure you look at that and make sure you're getting adequate sleep. Even overdo it for a couple of weeks. Build a daily stress reduction practice, be that breathing, breath work, be that walking, be that sitting outside under the trees. It doesn't need to be, an hour of meditation. It can be, what I took my coffee, and I frequently do this. I take my coffee into the backyard, stick my feet in the grass, and I do grounding, which actually very much relaxes me. I look at the sun in the morning and I smell the trees. It's like an all-in-one stress reduction practice, and I do it in the evening as well, as much as I can. And move your body. Movement is life. If you are sitting all day and you don't feel good, you need to get up and move. Be that walk around the block. If you're a busy parent and your kids, you get home, you got to get kids to sleep, take them for a walk in the stroller before you put them to bed. Get outside. It's good for everyone. And support your gut with fiber and fermented foods. I mean, these are ways that we can increase the microbes in our healthy microbes in our gut And if we have some stealth infections, we may be able to help squelch them a little bit. So if you've done all this and you still don't feel well, it's time to go deeper. And that's where what we do in the Precision Path program. It's tailored to your unique genetic, biochemical, and lifestyle factors. It's very precise, and this is a root cause medicine. We do advanced functional medicine testing, like I was talking, to look for those stealth infections like I had, that H. pylori that was completely asymptomatic. I never would have known I had it, which led to low stomach acid, which led to not digesting my food, which led to not having enough nutrients, which led to my thyroid having a problem because I didn't have enough nutrients. You get personal functional medicine protocols specific to your results, specific to how you're doing. We interpret some of those hidden drivers of disease. We do have options for Wall's protocol for MS and autoimmune neurological conditions, as well as Bredesen. And we go through a 12-month program of ongoing monthly visits until we get you to the place where you're feeling better, until we figure out what's going on and we take steps to remediate and we pull out all the bad things and we add new things. And that's why it takes time, because healing takes time. And for individuals that are like ready to heal their symptoms, you're sick and tired of being told that everything looks normal, you can learn more about our Precision Path program at AskDrKristina.com. You can see it right here. It lines out all of the work we do, but it really is the deepest dive you can do. And I think for those of you who are suffering and struggling, if you haven't tried anything, try these things. Many people feel much better just adding whole foods, increasing their sleep, and removing gluten. Many people. I also ask patients to remove dairy if they have thyroid issues for 4 weeks. See how you feel. If you're not sure, add it back in, see how you feel. I guarantee you, if it's bothering your body, you will know when you re-add it back. And the next step, start here. You can book a functional medicine assessment with me. You can do the comprehensive testing beyond TSH and T4. You can ask your doctor to go beyond that and take a look and just see, hey, do I have autoimmune stuff? I think that's a really good first place that you can reach out to your doctor who you know, who cares about you and who you know, can say, hey, I think I may have autoimmune thyroiditis. Can we check for antibodies? Can we do a full panel and see if I have inflammation? Can I look for reverse T3? But if you get to that place and you still don't know what's driving it, then it's time to do a functional medicine deep dive. And the plan is just for you. It's specifically tailored to what we find inside, to your symptoms, to your age, to your unique biochemistry, and your unique environmental factors. And if you're just interested in learning more with me, we have these free monthly webinars. You can join my YouTube channel at Ask Dr. Kristina. I try and always add actionable insights, things that you can do at home. Many people do well with just cleaning up their diet and following some of the advice that I give. That's just easy for you to do and it's free. Start there if you haven't started anywhere. But if you've done all that and you've been going from doctor to doctor, even from naturopath or integrative doctor, and they haven't done functional medicine testing, or they have and they've given you one protocol and they're like, that's it. We know in our practice that there are many layers and many steps that are needed to heal the body, including diet and lifestyle changes that take some time. And that's why we have the Precision Path program. I want to thank you for being here. It was exciting to share this information with you. If you want to connect with me online, I'm on Instagram at Ask Dr. Kristina and YouTube, and our website's bosnarhealth.com. Um, I really love helping people on their journey to optimal wellness, uncovering what messages their body's giving them, understanding the things that their body needs to feel in balance, and watching them be inspired by their body's ability to heal itself. And that I think is the most exciting thing for me. So I thank you for being here. I hope you learned something. I hope if you have someone struggling with things like this, who's been told like, those you're just getting older, oh, you're perimenopause, it must be perimenopause, which a lot of women get, that you reach out to them and you share this information because you might just be able to help them. And I'm here if anybody has a question that they want to ask after this. You can just maybe put the question in the chat. Again, if you've missed some of this, you've come halfway through, or you think there's information in here that a loved one or a colleague might be interested in, it will be up in the YouTube channel shortly, and you can share with them. And I hope that you've learned something, and thank you for sharing your time with me. And we'll see you next time. Bye-bye.